All right, here we are on Zoom. We had a little Instagram catastrophe. Well, it's not
Oh,
really our fault. I just think the
bandwidth,
system
what are you
was
gonna do?
overloaded. Yeah, I don't think it was either of us. So basically, I'll start off really quick. It's Mouth Breathing Awareness Month. It's May 5th. I'm talking about spreading the
Happy
word on
Cinco de
mouth
Mayo
breathing.
too.
On what? Oh, and
I said
Cinco de
Cinco de
Mayo.
Mayo.
Yeah. Yeah, I forgot about that. So, what I'm trying to do with this whole campaign thing is basically just create awareness around myofunctional symptoms. And mouth breathing is one that you don't even have to look in someone's mouth. You can literally just know, okay, if someone's breathing through their mouth, a kid or an adult, something's not right. And there's bigger health implications of doing that. So, by talking about mouth breathing awareness as kind of weird and almost like a joke that it seems like, it actually I think really helps spread information to people who need it. So
And I
um,
think mouth breathing also is just like you said, you don't have to look in somebody's mouth. You
yeah,
can
you just see
see
it.
it and then
Exactly.
ask yourself kind of why, right? Most
Yeah. Why
people
would that
really
happen?
do
Mhm.
believe, we've come to a position that people really think mouth breathing is the norm.
Yeah.
Um,
And it's just
Actually,
not.
Dr. Tara made a really funny joke about the Frozen 2 movie, the new Frozen.
Oh yeah, I haven't seen
Right?
it.
She's like drooling and mouth breathing. She goes, even Disney has
And
bought it,
oh
like
geez.
because it's like
Yeah.
it's what people do. So they always they try their hardest to make their movies as authentic to how humans are living, and I think that's a testament to show that it really has just
It's like
become
a part
second
of
nature.
society. Yeah. Yeah.
Yeah.
So I'll give a quick recap because not everyone will have seen that Instagram live that just kept pausing and not working. So um, we're friends because we've met through the Breathe Institute. I'm super happy and I was so honored that you ended up taking my MyoMentor program. So thank you for joining that. And now I get to highlight all my amazing MyoMentor graduates and students who have like so many become my friends like you. So
Yeah. And
we
I
also
didn't
work
get a chance
together.
to say, I'm really grateful that
Aw,
it was such an amazing experience, even
thank
being
you.
technically a seasoned myofunctional therapist. I
Yeah.
learned so much.
Awesome. Thanks for saying that. Yeah. And I know that we work together at the Breathe Institute. You are a hygienist, myofunctional therapist. You're based in Las Vegas. You work out of a dental practice where the dentist is Dr. Tara um,
Person.
Urson, and she
Hmm.
is doing a lot of infant frenectomies. And so just to kind of catch everyone up to that last, I mean, we talked for like 20 minutes, so I feel bad that now we're saying it all again. But
Okay.
yeah, I feel like your story is so interesting because you didn't always used to tell it.
Yeah,
And
I
you
didn't.
lecture, you speak, you do a lot in the field, but that was something that you never really opened up about until really just like a month ago before COVID at the
Hmm.
American Laser Study Club. So I think that'll kind of get everyone up to speed again, but why don't you go into some of the stuff that you already talked about?
Yeah, so that was just kind of the joke that like we had made a joke before this at um, Peter's symposium this year was kind of my coming out
Yeah,
uh, like
totally.
myofunctional disorder party. I finally made the decision that I thought changing my lecture and making it a little more personal would bring another level to it, and to understand why certain parts of it are so personal to me. And why I'm so passionate about it. But one of the parts of that we were speaking about before is that I think I am a little relatable to many people, that I really was in denial for a really long time, that I really was a patient that was suffering from poor myofunctional disorders, and mouth breathing being something in my mind that I could diagnose and tell from anyone. But
Hmm.
the longer I did it, I just was hard. It's hard to say that. I mean, there is like a faux pas to it. There's like
Oh
something,
yeah.
there's a
And,
stigma
and
on it.
and you don't have like the narrow, long face like me, so
Yeah, no,
you can
exactly.
easily fit into that category of people where it's like, well, wait a minute, like you don't really seem like you have that structural problem. You don't look like you have a super narrow palate, so you
Yeah,
can
it's
fly
not the
under the radar.
typical, yeah,
Yeah.
not the typical functional face that we're kind of like, very V, kind of really pointy chin. I mean, it's there a little bit, but I can highlight and contour. But for me, when we were originally talking on the Instagram live, where my story was a little different was, you know, I got into function and into airway because of teeth, right? So orthodontics was really where I where I lived, and I consider that my home base. And that's why I don't talk about the hygiene stuff a lot, because that was really just something I ended up having to do because of, because of licensing and because I wasn't smart enough to be a dentist, hence because of some of my educational issues, which
Yeah.
now I know are directly related to my functional disorders, which is my mouth breathing issues at night. Because I really did align mouth breathing, low tongue posture, reverse swallowing being directly related to a side effect of crowded and crooked teeth. And I did not, that was not me, right? I, for the most part, never had orthodontics.
Yeah, your teeth are straight and like look really
Yeah, and I
good.
used to always tell everybody like I always thought my smile was okay. It was over, I think, 10 years, I really did start to notice how my smile started to change. And it was even getting, more tightened. I knew I clenched and I grind, but I used that as a comparison to the fact that I was high stress, I had anxiety, I had all these other things. Again, not connecting the dots that those were all connected as well.
Yeah. Because
So
and connect those dots for people who don't know. So
yeah,
clenching and grinding, how is that connected to some of these
to
breathing things?
functional disorder. So we know that clenching, grinding, bruxism. So right, I like to say that when you're young, you grind because you're a little more carefree and spirited, and the older you get, you clench and you grind because you're trying to control things. But we now know, and we are getting better with research, that that's due to the fact that you have some type of airway disorder, that your tongue is sitting low in the back of your mouth. And even if you're, so in my case, where UARS, and what we were talking about a little bit, is that's me. That's another component of sleep apnea and sleep disordered breathing. It's upper airway resistance syndrome. So it's different than OSA because people with UARs really don't ever get into good REM and they don't sleep. So they are way more likely to live in fight or flight.
Yeah, and what we were saying before is they're usually younger, female, healthier, like they're not that stereotypical old
Yeah,
overweight
they don't
man.
have large neck circumferences.
Exactly.
They're not showcasing. They're not.
So they fly under the radar, and it's really common, and it's a lot of
Exactly. And
women.
one of the things we were talking about is that I would have never really said to myself that I was a snorer. I would have said I only snored when I was very stressed, extremely tired. But that were the only nights that I was actually really getting into REM, because the rest of the nights I was this very, I'm this very light sleeper. And the joke is like my husband, I talk in my sleep sometimes. I will also, I wake up in a panic. What's going on? Like, because I'm living in this very light twilight. So UARs, some of the symptoms and side effects of that will be high anxiety. You'll feel, so, I find daytime sleepiness to be fun, like an interesting in this category. Yes, I'm tired, but I don't know any different. So it actually is my norm. And because of my high energy in this fight or flight, I probably don't notice the daytime sleepiness as somebody else who does get REM.
Yeah. Yeah,
So a
because
lot of,
you're living on adrenaline. So
yes,
your
exactly.
body is just in this like hyped state, and you don't necessarily feel tired, but you're actually exhausted, right?
Yeah. Oh, you're shot. Exactly. So you'll drink more coffee. You'll be more, likely to drink caffeine. You can drink too much. You're also probably most likely the person that I can drink a Monster and then technically go to bed.
Yeah.
Yeah, which is right. It's crazy, but that is because of the way my body produces and how much my cortisol levels are high, which all really then go into mental health. And those are all things that we know. If you live in a fight or flight, or your cortisol levels are high, your body is producing as if you are in war. Like, you're stressed. You're clenching and you're grinding because your body, your vagus nerve is just trying to trigger, hey, are you okay down there? And
Yeah.
so one of the things we didn't get to touch base on with my story was, so I knew all these things. I knew that my grinding was making my teeth so tiny. I knew that I was vertically becoming more and more deep, shallow, and then
You think your bite
falling
was
back
getting
even
deeper
more.
and coming back more?
Mhm.
Oh,
Because, even if you look, you can see, like, I've actually even had to, like, even out parts of my teeth, have dentists
wow.
now. Because I'm in the dental field, I can do these things
Yeah.
and most people wouldn't. No, I did not.
You can mask all your symptoms better.
Yeah, I don't have to pay somebody to go and do it. But one of the things was, when CBCT scans became way more accessible and we started really putting that as part of our diagnosis, I tend to work with a lot of doctors that are, well, the ones that I'm with now have been doing it a long time, but especially with lecturing and stuff, a lot of times we're the ones introducing it.
Yeah.
Like sure. They've just touched into it, so they've come to you or me or lately, to our people, Breathe Institute and stuff, because they want more information. So sometimes when we're with them, they don't have all the materials to do the perfect diagnosis. So I really, besides Breathe Institute, I hadn't had a doctor that had a really great CBCT scan. So I really had never taken one on myself.
Yeah.
And actually somebody who I think as well, or not, he's up in Portland, Dr. Caddy, I'll give him a little shout out.
Oh, I remember him. Yeah.
Yeah. I was up there doing some work with him and he went all in and bought an amazing CBCT scan.
Cool.
And he was like, we're kind of showing, and he's like, well, let's do yours. And I remember being like, oh no, I'm okay. Because in my mind, I knew it was going to be small, right? I wasn't not prepared for that. And I don't mean to go off on a tangent, but I was lucky enough to sit on the Bill Hang, the whole residency, and be part of that for a whole year. And Bill's biggest, one of his lovely lines is, you better have, you want a garden hose, you don't want a cocktail straw.
Yeah.
So,
and just to really quick make sure everyone's on the same page who's listening, she's talking about the size of her airway. So her breathing tube that she's supposed to get oxygen through when she's awake and when she's asleep. This is what she was afraid was going to be so small.
Yes. So I didn't want to, because by seeing it, that's science, right? So then it was like,
yeah, you can be in denial when you don't actually see it, right?
It's funny. If anybody is listening to this, a question I would even ask myself, why? What are you why would you be scared, or what's the big deal? I really identify myself with these symptoms. I mean, it's who I am my whole life, right? I've been this high energy person. I've worked years of therapy and figuring myself out and growing and developing, overcoming these challenges. So there was something very personal for me to just be like, wait a minute, was this really because of my sleep issues? I don't know if anyone has never dealt with, I'm sure everybody has dealt with personal triumphs, but when you've really put a lot of work into yourself, or you've overcome obstacles, to kind of say to yourself, wow, that's something could have been fixed. It could
have been avoided.
Yeah, avoided. There's a part of you that it takes a minute to get your head around that and to accept it. Yeah. So the long story short is I took the CBCT scan. It was so small. It was smaller than a cocktail straw. And I know you've seen it. I remember the moment I took it, I took a snapshot of it, and I text Dr. Zaghi and Dr. Koppelson, and I was like, what do you guys think of this? And I think something along the lines, I don't want to quote anybody, but I think he's like, whose airway is that? And I was like, mine. And he's like, and they were like, wow, oh my gosh. It was definitely a loving of wow, Melissa,
let's help you. Yeah. They love you. Yeah.
Yeah. No, and it was definitely with love, but it was wow. I don't think we all knew probably it was small, but it was a big moment. And actually, during the Florida lecture, we're name dropping today, if anyone hasn't noticed, but Paula was sitting in the front left, and it was a good size audience. I was paying attention to a lot of people, but I remember hearing Paula in the corner of my mouth. She'd be like, that's your airway? And I thought to myself, oh, well, but even that now, to airway people, they're like, ha ha, that makes so much sense. Because it does explain a lot. It explains why it's personal to me and all that kind of stuff. But, to go back to where this Airway Awareness Month and what you're doing is that here I am, somebody who's a professional, I think some people would say, definitely been around for a while, and a huge advocate, provider advocate, patient advocate. And I wasn't even advocating for myself because I wasn't looking at signs, because I was still in a way trying to think Okay, I don't walk around with my mouth hanging open.
Yeah, you don't have obvious problems,
Yes,
like,
exactly.
yeah,
And
no, so I'm so glad that you're sharing this because I do think patients will relate to it. Providers, it helps us be able to understand our patients a little bit better because everyone says they're fine. Like no one said, typically no one's like, oh yeah, I sleep horribly unless it's really bad. But for these kind of in between people who are maybe a little in denial or in the situation where you are, nobody really wants to acknowledge when they've got these things. And I don't really know why that is because I guess it's just normal to us.
it
So
is normal to us. I also think, one of the things we touched on that was also, for a long time, I like to give dentists and doctors a lot, more credit than, I don't think that we didn't, we all took anatomy. We know how things connect, but sometimes when that onion starts peeling and it's, you start peeling one layer and all of a sudden something else comes of it, it's difficult to understand that how am I going to talk about mental health or anxiety in a dental
yeah, in
chair?
a dental
That's just
office.
not what we were trained to do.
Mm-hmm.
Um, I think times have changed, and one of the things I had left that lecture was like, and I know you definitely are aware of this and would probably agree, is where we've come from in 10 years is,
Oh my gosh.
I mean, night and day. And I always want to give credit on that and remind us, but there's so many layers that have to be added, and that's why this multidisciplinary type of treatment style that we advocate for and talk about all the time is crucial, because not everybody, you can't do everything, and patients need more than just one provider being able to offer it. And
Yeah, for sure.
but the simplest thing that somebody can do is just ask themselves, why, if I close my mouth and I'm just sitting there, and even if I just start to feel uncomfortable, not that you can't do it, right? Like just keeping your mouth closed for 2 minutes. I know that's one of your tests. And I
Yeah.
start to feel my body temperature change. I start to feel just a little uncomfortable in my own skin. If you ask yourself, why is that normal? And does that happen more than you realize?
Mm-hmm.
Something really small like that can be a really great way to just start to ask yourself questions and then help yourself build information so that when you do go to your provider, you feel like you're talking the same language. You're not being accused of something. You're actually
Being
having a
self-aware.
discussion.
Yeah, and you
Yeah.
bring up a really good point because a lot of people who mouth breathe, they nasal breathe for like 2, 5, 10 minutes straight, and then they do one big breath through their mouth,
Yeah.
and it resets the whole CO2 system and it kind of brings them back down to those unhealthy oxygen levels, right? So you can do nasal breathing and then do one big mouth breath and
then it brings it all down. Yeah.
and it resets that. Yeah.
One of the other things, and I know you love how I make all those silly jokes, but one of the things, like, especially like we always, little girls or kids that get so caught up in, or even adults, I get so fixed, I'm so upset, I'm hyperventilating in this
Yeah.
way.
Yeah.
And you're telling them, take a deep breath, take a deep breath. And sometimes I'm in my mind, for me, I really wanted to turn around and be like, I am breathing, because that hyperventilation, like, it's very difficult for someone who doesn't know the difference of diaphragmatic to chest breathing, how to change that and how to really work on that. I talk a lot to patients, like, you're a mouth breather when you go to yoga and you're like, that thing's not for me. Like, because I took so many yoga classes, and when they were like, breathe into the pose, I was like, I am breathing. Like silly little things like that I thought, like, I couldn't do yoga. I didn't know how to breathe, so therefore I couldn't do yoga.
No, that's such a good point. Oh my
Yeah.
God.
So there's so many aspects of mouth breathing that you can look into and really, really see. And I think
Yeah,
building more awareness to it will really help
for
people
sure.
understand that it relates into
Well,
many
let's go
different.
back to a point that we touched on the Instagram live, and that it'll be a good way to kind of bring it full circle and relate back. You dug up pictures from when you were a little girl
Oh
and
yeah.
you're 5 years old mouth breathing. So imagine what if somebody knew about this back then?
Oh yeah.
How different would your life be, right?
Oh, hands down. I mean, if
Crazy.
they would have told me, if I could have gotten a little more forward growth, like, they would have put me in something to help me grow to my full potential, how much more airway I would have gotten. Would I been able to, like, that reading, when we talked a little bit in the Instagram, I talked a little bit about my school my study troubles.
Yeah.
And that one of the things that was very hard for me was I would, if I had to read silently, I would read a page. And by the time I got to the end of the page, I didn't remember what I read. And that was embarrassing. I didn't know how to tell anybody that. So I didn't really absorb information. It wasn't until college that somebody, or late high school, that somebody told me to read out loud. But that is a sign of the fact that because of my breathing situation, I wasn't able to really breathe calm and
Focus.
consciously, let that information settle and absorb, because my mind is racing because I'm living in this hyper cortisol level, and that's my norm. And then I become anxious because I've built a defense mechanism to this, to this type of situation, and it becomes a circle. So one of the questions I asked myself was, when I was diagnosed with ADD and ADHD and a slight learning disability, was that because I have maybe I do now, maybe that's the side effect of having UARS for a long period of time. I know there's a lot of discussion.
Yeah.
Exactly.
Yeah.
Having lack of oxygen during, crucial growth and development times is the side effect that you tend to show signs of what we now call ADD and ADHD. Who knows? I'm not saying that I know for sure. I just am constantly thinking of that, because when I started reading out loud, working on breathing situations, I'm not dumb. I know I can learn. It's just, I really had to work on how to learn and compensate for these other things. So I think a lot of parents and all people can really recognize and relate to children and even themselves that have these issues. One thing I'd like to say is I even asked you, I said I had put up an Instagram post a couple of days ago, and I wrote mouth breathing isn't normal just because your mom does it. And it was a picture of a little girl and a mother laying on the couch with her mouth open. And I just assumed, I didn't put any tag on it. I just assumed it was inevitable that everybody knew that was me and my mom. That wasn't a picture I took. And I said that to somebody, they're like, that was? I go, so think about that. I had seen that picture so many times. And, in Florida, I know, my mom was there. It was the first time she ever saw me lecture. And I kind of put my mom on blast. I was I put pictures up of her who had lots of sinus situations.
Yeah.
During COVID, I actually spent time going through all my photos. I found my mom's baby pictures. I'm going to work on it for some of my upcoming projects. I saw my mom in a complete crossbite, anterior crossbite. I could see where her midline deficient was, how part of her maxilla. It was amazing that when I stopped and I went through and archived these photos, what I could see from my family. It's nothing new. We've always been doing it. We just didn't know what to look for.
Yeah, no, exactly. That was a perfect way to wrap it up. Thank you for sharing your story. I want people to know how to get in touch with you and a little bit more about what you're doing. So,
and I think one of the things we were going to possibly talk about was, I just would love to just wrap up real quick, is that, where I am a big advocate now, and I'm very important about, to talk about mouth breathing, making sure that we have enough space in our upper arches for our tongues.
Yes.
So that it can go forward. And just in this case, my tongue does sit up in my mouth, but because I don't have enough room in the back of my throat, it's just the same as if my tongue was sitting on the bottom of the floor of my mouth.
Yeah.
So part for providers, really understanding that whole structural thing of where the orthodontic component fits into, making sure we have the proper structure so that our tongue can sit there and breathe is really important. And I know we were going to talk a little bit about
the course that we're going to be the Breathe Institute.
About Breathe Institute.
People should know about. Yeah. So it'll be you, Dr. Kevin Koppelson, and Dr. Zaghi.
Yep.
Teaming up to talk about tongue space and some of the orthodontic options. And
Dr. Zaghi's been doing a lot of work. And also in that Florida lecture, I know he decided to open up and change a little bit of his path, talking how important tongue space is, as well as the frenuloplasty, frenectomy, myofunctional therapy, all the components. You can do the
functional stuff, but if the structural component is not there, if you just don't have space for the tongue, now you've got issues.
Yes.
So talk a little bit about that course. It's all still
part of it's also going to be that we're going to just tell people. So the question is, what am I going to do about this?
Yeah.
So I have decided to team up and have Dr. Koppelson do FAGA on me, which is from the Beauty Institute. It's an appliance for forward growth. And we're going to be documenting that story and kind of, I believe it's a lot of stuff still has to be worked out, but I believe we'll be doing that through Breathe Institute and possibly some stuff with me here in Vegas. We're going to talk and follow my story on that. And I believe that's going to be part of us bringing in the orthodontic aspect to this whole functional approach.
Yeah.
And putting that as part of your guys' new course path. I know you're doing a lot of work with them for that, helping them build courses and stuff.
I think the message should be everyone stay tuned to the Breathe Institute because there's a lot of new courses, course offerings coming out. And there's a myofunctional course that I'm part of with Sonda and Diane Barr, and the ortho thing that you're part of with Dr. Koppelson. And so there are going to be a lot of new things coming out of the Breathe Institute in the rest of 2020 and 2021 for sure. So
absolutely. We want to talk more about appliances and all that kind of good stuff and talk about how it all works. So
yeah, no, I'm excited. So, I'm glad that we can even talk about that and share it because I think a lot of people who would watch this would also be interested in that too.
Yeah, we want to make sure that everybody who's doing great stuff is, acknowledged and they always get to keep tuned. So yeah, anybody who ever has any questions, I'm more than open to discuss. Anybody wants to know more about UARs or just talk to me personally, they can always message me on Instagram.
I'll link your Instagram, Facebook, everything in this video that we talked about, I'll link so people can get in touch with you.
And they can email me directly. They can email me, Melissa at the Breathe Institute, or my personal, which is mugno.melissa@gmail.com. And then follow me on any of the social media posts or any of the social media feeds.
Okay. Well, thank you so much for doing this. And I love that you're opening up about your story because and that's why I wanted to do this. It helps make things relatable and it helps patients connect the dots. And I think it helps other providers, doctors and dentists and hygienists connect the dots as well. So thank you so much.
Well, thank you for always doing what you do. It's such a pleasure.
All right. Bye.
Bye.